Dr. Manor Haas. I'm an endodontist from Toronto, Canada, and I just want to borrow a couple minutes of your time to talk about something that is very important for us in dentistry and endodontics, and that is the use of antibiotics. And the reason why I bring this up is because very recently the Centers for Disease Control and American College of Physicians have brought out announcements about the overuse of antibiotics in medicine. Now, even though that's medicine, it's still very important to talk about this when it comes to dentistry and endodontics. So it boils down to give or not to give. And the best way I can review this is by showing you a couple of cases. So imagine this patient comes to your practice tomorrow morning and they have pain to cold or hot. There's a deep carious lesion that is into the pulp. They're symptomatic. Now, I can certainly understand that good-hearted colleagues would say give antibiotics because they're in pain. They want to just get them comfortable. But you need to stop and ask yourself, is there infection involved in this case? So it's pain to cold and hot, which means there's no infection, there's no bacteria. It's still vital. Too sensitive, but it's still vital. So do you give antibiotics? No, it's not indicated in a case like this. Take the same case and fast forward this now. And the same patient had a root canal treatment, and now they have an apical lesion and they're tender to percussion. Do you give antibiotics or not? Well, we know there's infection in the periapical area. Very likely there's infection in the root canal system. If you give an antibiotic, you have to remember there's no blood supply to carry that antibiotic into where the source of the infection is. And so maybe it'll prevent spreading the infection for a short period of time, maybe, but it's still not going to treat the source of the problem. So is it really indicated in this particular case to give an antibiotic where there's no space infection, there's no lymphadenopathy or anything like that? No, it's not indicated. Same patient, fast forward this one, and the poor patient now presents to your practice tomorrow morning and they've got a big swelling. There's lymphadenopathy, there's trismus, they can't swallow, they don't look well. Do you give antibiotics or not? Absolutely, that's an obvious one. You give antibiotics. The only question might be, do you give one? Do you give two antibiotics? Do you combine them perhaps? You definitely would want to give a loading dose. The point is, you give antibiotics. So I covered this from one end of the spectrum to another. If there's pain to cold or hot, it's still vital, needs root canal treatment, but antibiotics are not indicated. And on the other end of the spectrum, if they come in, there's a space infection, they're swollen, they don't look well, absolutely you're going to give them antibiotics. So I hope that makes sense. I hope you learned something from this. If you need more information, you're always welcome to visit us online at dentistrytoday.com, or you're always welcome to visit us in print. So thank you very much for your time. I hope you learned something, and have a wonderful day. Thank you.